Hello, this is Dr. Darshana again, and now we're going to talk about pelvic floor muscles and sexual health. And here are all of my toys, okay? Just to get everybody oriented, this is what a pelvis looks like. This is a human-sized pelvis, and it lives in our body here where an underwear would be. All the white parts that you see are the bones. All the red parts that you see are the muscles, okay? This is external female genitalia. It's called the vulva, okay? These are the outer labia, these are the inner labia, and the vagina kind of connects on the inside. So in a human body, that would be like this going inside and the uterus in the end. So kind of like this, okay? Now that we know all the anatomy parts, often people think sex starts in your genitals. It doesn't. It starts in your brain. Your brain is the most sexual organ, and it starts with sexual desire. Because it starts in the brain, it is impacted by whatever else lives in your brain. It is impacted by, did you sleep? Are you tired? Do you like this person? Do you feel safe? Are you stressed? Do you have anxiety? Have you had trauma? What does your religion tell you about sex? What does your culture tell you? What did your parents tell you? What else is going on here, right? So generally speaking, sexual desire is influenced by whatever else lives here. Once that happens, your brain sends that message to your body. That is called sexual arousal. What that means is it is going to increase the tissue temperature and blood flow of your body in certain specific areas that have more of a sexual pleasure context, and that can be individualized, right? It's the same process for men and women. In men, genital tissue is outside, so you can see that change. The obvious change of sexual arousal is change in shape, size, and temperature of the genital tissue. Because the male genital tissue is outside, you can see it with your eyes, and we call it erection. And that's when we know that you're ready, right? Same exact genital response for women. There is increase in tissue temperature, shape, and size of the vagina changes, except it doesn't happen outwards, it happens inwards. So the easiest way to imagine this would be like a pop-up tent. Anytime you're just walking the earth and you're not using your vagina, the tissue folds down and doesn't necessarily take space. But under the right context, which is there is sexual desire, you have hormones that give you sexual arousal and cause blood flow changes. Now this vaginal tissue is going to pop up like a tent inside the body and take up space. That's called vaginal elongation. Because it is inside, you can't see it. That's why most of the times we don't know when you're ready, right? And the other thing that influences this is in order for the vagina to expand inside your body and be ready or receptive for penetration, pelvic muscles that are around it need to yield and give up that space. So here is how it plans out. If this is the vagina tube, muscles are around it. Now, if my muscles are really tight, what do you think is going to happen? There is no space for this tissue to expand. That's where when we see people having pain or difficulty with any vaginal penetration, 9 out of 10 times pelvic muscles are involved. Sometimes the problem is in the muscle. People have tight muscles, that's why they have pain with penetration. But many other times, there is pain with penetration for multiple reasons that makes your body respond or react with a muscle guarding or muscle spasm. And if you repeat that several times, now your muscles just stay in spasm or tight mode at all times, okay? That's when there is a problem. But if things are going normally, you have sexual desire, which then causes the hormonal changes to make the blood flow change, which then will allow the muscle to relax to create space for penetration if that's desired. The rhythmic contraction of the muscle in that case is what stimulates the nerves, which can be a pleasurable sensation, followed by muscle squeeze that is building on top of each other, which is then called the climax or the orgasm. So if you think about muscle response during sex, muscles need to be able to lengthen. They need to have full length of stretch for the opening, and then they need to have full squeeze so the contraction is strong enough to give you a good orgasm. A lot of the times people think that they just need muscles that can squeeze really well and they need a tight vagina so they can have better sex. And here's the myth with that. Pelvic muscles are muscles around the vagina. These are skeletal muscles like your bicep, tricep, okay? Vagina itself is a muscle. It's a smooth muscle like your throat or like your gut or like your bladder. We don't get to control how tight or loose it will be. I think the word tight comes from a lot of cultural normatives, a lot of patriarchy that is outside of discussion of this video. But what I'm trying to tell you is when you're doing a million Kegels and thinking you're making your vagina tight, you're actually making your pelvic floor muscle tight. And Kegels are not the enemy. I'm not in anti-Kegel camp, right? Kegel exercises are when you're squeezing a muscle a lot. It is very helpful if your muscle is weak. If your muscle is not weak and you're constantly squeezing it, you're going to make it very tight. Then the question is, what could it hurt? Well, here's what it could hurt. Like I explained to you, muscles need to be able to relax to allow space. So if somebody has really tight pelvic muscles, they're more likely to have discomfort, pain, or sometimes impossible penetration. Second, orgasm is an intense contraction of a muscle. A muscle can contract strongly if it lengthens fully. Here's an example. If you ask me to punch you from here, it's not going to be a strong punch. But if I really need to take you down, I'm going to go here and punch, right? Why do you think that is? Because a muscle that lengthens to full length will generate force. Now take that knowledge to pelvic floor. It's like a hammock muscle. If it lengthens fully, it's going to contract strongly. So when you are in an elevator going to the 100th floor, you're going to feel the high if you started from the floor. If you get into the elevator on the 95th floor and go to the 100th floor, you're not going to see that much of a high. So sometimes people with tight pelvic floor will have symptoms like it takes too long to have an orgasm, or it just doesn't get there, or it is not like what it used to be, or it can plain hurt because the muscle is overworking at all times. This is outside the scope of this video, but just for general knowledge, same exact response of the pelvic muscle for male sexual health response. Men have the same muscles. They need their muscles to be able to have normal length and be able to relax so blood can flow into the penis. And then they need the muscles to have good strength and good squeeze and have no trigger points so it can hold the blood flow. It's sort of like tire on a water hose, right? Like if you stop the blood flow, that is what will help maintain the erection, right? So a lot of times pelvic floor problems in male sexual health will show up as erectile dysfunction or pain with erection or pain with ejaculation. So that's how pelvic muscles are connected to sexual function. Thank you.